Hi, we're Team Robo, and we're here to talk to you about next generation robots in healthcare. So, how many people a year do you think die from medical mistakes? And then we'll pause and take a few suggestions on it, and then I'll give them the answer. In a study by John Hopkins published in the British Medical Journal, they estimate around 250,000 people a year die from preventable medical errors. That would make it the third leading cause in the United States. So, one of the more recent developments in medicine is the use of robotics in surgery, and they help give a higher level of control and precision to surgeons that they otherwise wouldn't have, thus helping cut down on some medical errors. So, by a show of hands, if you were having major surgery and you were given the option for a traditional surgery or a robotic assisted surgery, how many of you would opt for surgery with the robot? And then I'll take a few takes on that, and then I'll ask on the other side how many would rather have the traditional surgery, and I'll take a few takes on that, and then I'll tell them. In the following slides, we're going to explain a little bit more about what robotic surgery is, some of the pros and cons of robotic surgery, and where the future of robotic surgery is going. So here's a few terms to be familiar with about robotic surgery. The first is remote surgery, and it's the ability for a doctor to perform surgery on a patient even though they are not physically in the same location. The next is autonomous robot, a robot that is programmed to act on its own outside of stimuli. Robotic surgery is a method to perform surgery using very small tools attached to a robotic arm. The surgeon controls the robotic arm with a computer.
Robots create many opportunities in healthcare. A few of the goals of using robots in medicine is to provide improved diagnostic abilities, offer a less invasive and more comfortable experience for the patient, have the ability to do smaller and more precise interference, also reduce blood loss and transfusions, a chance for faster recovery time and less scarring because a surgery will be less invasive and more comfortable, and reduce the risk to pharmacy technicians when dealing with syringes and toxic medications. Robots can create the opportunity for less time in an actual surgery. Also, surgeries that last for hours can cause even the best surgeons to experience hand fatigue and tremors, whereas robots can be much steadier and smoother. Finally, robots may be able to work longer during the days and weeks than a full-time staff, which in turn costs less for the hospital.
In addition to all of the benefits, there are also many challenges that come along with using robots in surgery. First, it is very expensive. The current robots used for robot-assisted surgery cost about $2 million, and each surgery using the robot is typically $3,000 to $6,000 more than traditional laparoscopic surgery. Next, robots have a limited mobility. Once the surgery has started, the robot cannot be repositioned. This can cause problems if the surgery needs to cover a large area of the body. The robot also faces challenges when dealing with soft tissues. These tissues are slippery and can be very unpredictable. The technology has a long way to go before autonomous robots are reliably performing surgery on humans. This topic also faces many ethical and legal challenges. Computer-assisted surgical systems are currently the only FDA-approved robots in surgery. An autonomous robot would require extensive testing before it could receive approval. And the thought of having a robot perform surgery on a human raises many questions. What procedures would need to be in place in case of malfunction? How much testing is required? Who is held responsible in case of malfunction? How much maintenance is required? If we are all able to answer all of these questions and overcome these challenges, robots could have a bright future in the healthcare industry.
The future of robots in surgery. The most recent robot we have developed is called STAR. STAR stands for Smart Tissue Autonomous Robot. With STAR, with the supervision of a human, this bot stitched up a pig intestine on its own better than a human. STAR is able to perform soft tissue surgery due to the technology of nerve tags placed in tissues, while a nerve camera tracked the marks and while a 3D camera recorded images from the surgical field. This technology will help create opportunities for healthcare in the future. According to the BMG, medical error is the third leading cause of death in the United States. Having a robot who is programmed to perform a certain surgery with a doctor keeping watch will help reduce the amount of medical errors in the future. In conclusion, robots in healthcare will help create opportunity for healthcare by improving diagnostic abilities, being less invasive and more comfortable procedures, being more precise, and reducing time. They also face some challenges like they're very expensive to produce and their programs may not be as reliable. They also create ethical issues. But in the future, autonomous robots will help reduce the human errors that we will have in surgeries in the future.